Part of the obligation of Better Health Partnership as an organization is to make an annual report of our activities. We've always included that as part of our learning collaboratives, and today is no different. So to report on the activities of Better Health Partnership over the past year, I bring you my dear friends and colleagues, Rita Horowitz, the president and CEO of Better Health Partnership, joined by Chris Mundorf, who's director of data analytics and reporting for Better Health Partnership. Rita and Chris.
Thank you, Donald. It's wonderful to see everybody. Thank you for joining us today and for coming back, hopefully after the break. I never quite know about that. I must say, though, after hearing the speakers before me, and Miss Marilyn, you're going to be a very, very hard act to follow. So I will do my best to keep everybody's attention like she had. I hope you're all feeling as inspired as I am from the presentations this morning. And Miss Marilyn, I think that if we had done this collaborative in person, you may have seen an awful lot of tears in that audience today. And I think you would have been overwhelmed with hugs from everybody afterwards from your powerful words. So thank you for sharing those with us. Before we get started, let me mention that we are planning, and the key word here is planning, to see everyone in 2022 in person again. As of right now, Better Health Partnership and our sister collaboratives in Columbus and Cincinnati are planning a statewide learning collaborative in June that'll be held in Columbus. For everybody to come together from across the state. And Better Health also plans to hold its local learning collaborative in November in 2022 at Corporate College again. Carol and I figured that since they've been holding our deposit since 2019 on that venue, we really ought to cash in on it. So here's hoping we can all learn how to coexist with this pandemic and move forward with that. As Donald mentioned, Chris and I are excited to feature some additional highlights of our programmatic work, of our members working together to make a difference in the health and the well-being for so many, many, many individuals living in Northeast Ohio. I'm going to share updates on infants and children's health, and Chris will center more on our adult health work, and he'll share some early social determinant of health data emerging out of our Pathways Community Hub, which you heard a little bit about in the Woodhill transformation presentation. Next slide, please. So I wanted to open up my presentation today with this slide, which I believe visually captures the very spirit of and the value that collaboration brings to our community. Organizations who have the courage to take chances and risks to make significant change. Our members work together to make a difference and reach across the aisle, if you will, with their peers to collaborate, innovate, and find lasting solutions for positive change in our community and with the thousands of individuals living in Northeast Ohio. To quote Miss Marilyn earlier, our foundation is built on the spirit of people, members, and trust. As you also heard or saw in the chat, at least from Dr. Ted Winslow earlier, change happens at the speed of trust, and trust happens at the speed of relationships. And no one knows this experience better than Better Health Partnership's members, and just how critical trust is to helping us be successful and accomplish our mission. Through the years, to help facilitate that trust, Better Health has provided that safe space for our competing health systems and others to share their secret sauce for success and their best practices that have resulted in many significant improvements in healthcare delivery in the community that we've all enjoyed. And speaking of change, the global pandemic has brought on new challenges and accelerated the need to innovate, and has shown that the most successful organizations were able to pivot and profoundly change the way they deliver healthcare to the communities they serve. And collaboratives like Better Health Partnership also needed to pivot and innovate to ensure that our priorities stayed in lockstep with this changing landscape. But innovation and change doesn't happen without strong and influential individuals leading the way to motivate others to change, to create experiences of exceptional value and lasting impact. Next slide, please. One such influential leader is Dr. Donald Ford. As you heard him mention, he's been promoted to the chair of family medicine for Cleveland Clinic. And we just want to take a moment here to acknowledge Dr. Ford's leadership and his influence in our collaborative efforts over the years. And I know many of you join me in this heartfelt acknowledgement. Donald has worked with Better Health since 2013, leading our clinical advisory committee, moderating our convening events and learning collaboratives, which you can all see how he does it so very eloquently, and serving as our chief medical officer for the past 4 years when I assumed the role of CEO. His expertise, his knowledge of the healthcare system, his passion for community health and health equity have contributed strongly to our successful expansion and our pivot in providing new services that now operate at that intersection of healthcare delivery and social determinants of health. We wouldn't be where we are today in this newly expanded space without him. He's been instrumental in helping us establish the Pathways Community Hub in 2020 and its value proposition for health systems and community organizations to work together to better coordinate care for individuals and patients with challenging social health and economic needs in Cuyahoga County. So although Donald will no longer be able to continue in his chief medical officer role for us, we will continue to work with him and his primary care teams at Cleveland Clinic to help achieve our mission and goals for improving equitable population health in our community. And something tells me that with his love of theater and acting, which he didn't mention earlier, we just might see him on the stage again sometime. Next slide, please. So, Donald, thank you for your leadership and all you've done for us in our community. We wish you all the best in your new role going forward. Next slide, please. So I will start with the updates on our babies and share how we're working together to make a difference to support maternal and infant health across our region. In 2018, clinical experts from our birthing hospitals in Cuyahoga County formed Action Team Number 4, led by Better Health Partnership, which was one of 11 action teams under that umbrella of First Year Cleveland, working on infant mortality, came together to share data, to hold learning circles, and commit to quality improvement efforts to reduce extreme preterm birth, the leading cause of infant mortality in Cuyahoga County. Our improvement work centered on helping moms get better access to prenatal care and timelier interventions for high-risk pregnancies. In 2020, this graph shows the lowest preterm birth rate of 11.4 was recorded since 2015 when it was 14.9 in Cuyahoga County. We'll all be curious to see if this trend continues. But I also want to point out that it's not all good news. There still exists a very large disparity between the county preterm birth rate of 11.4 and the African American preterm birth rate of 15.5. So, as I know I share with many of you on this Zoom webinar today, we believe that social, mental, behavioral health, and economic factors are definitely contributing to this disparity. So Better Health Partnership is embarking on an initiative with our Pathways Community Hub called Nourishing Beginnings with First Year Cleveland, the Greater Cleveland Food Bank, and Case Western Reserve University to help pregnant individuals experiencing food insecurity obtain access to healthy food to promote a healthier pregnancy and achieve better birth outcomes. This project is just getting underway, but we absolutely will share our progress with you as we go along. Next slide, please. So next on the continuum is children and the work we're doing together to make a difference related to the factors contributing to children's poor health outcomes. We know there's a strong relationship between children's health and academic student success, and our collaborative partners want to do all they can to help children reach their full and academic potential. The childhood conditions that we're focusing on include asthma, obesity, lead exposure, and mental health. For those of you who don't know, asthma, left uncontrolled and aggravated by environmental triggers such as air pollution, is the #1 medical cause for school absenteeism. You're going to hear a little bit more about asthma and its relationship to air quality and climate change, later from our climate change group. Exacerbated by the pandemic, childhood obesity rates in Ohio and across the United States are at epidemic levels. Obesity left unattended will result in experiencing chronic disease such as diabetes and hypertension as adults. And I think Dr. Sherry Boland did a great job earlier this morning of drawing those connections and being concerned about the cardiovascular health of adults in our community. With regard to lead testing, why are we focusing on lead testing improvement? Well, studies in Cleveland children have found that children with elevated blood lead levels are 27% less likely to be on track for kindergarten, are 25 to 30% more likely to enter the juvenile justice system, and 34% more likely to be incarcerated as adults. No matter how small, there are no safe levels of lead, and lead poisoning is 100% preventable, and we are out to eradicate it. And finally, and maybe most sobering right now, is how the pandemic has exacerbated mental behavioral health issues in children. Suicide is now the leading cause of death of children 10 to 14 years of age in the state of Ohio. That was stunning to me. So we need to work together with these issues and to help improve the health of our children. Next slide, please. So these are the organizations that are currently reporting their data to Better Health Partnership on children's health and working together to address these issues. They make up the Better Health Partnership Children's Leadership Team, and this is co-chaired by Dr. Stephen Spalding from Akron Children's Hospital and Dr. Drew Hertz from University Hospital's Rainbow Babies and Children's and Tech Neon Company. We also have subcommittees that work with our children's leadership team that consist of providers, social services, community organizations, school systems, academia, who work on these strategic priorities that I've just mentioned. Next slide, please. So understanding that each of these conditions I've talked about are contributing to poor health outcomes, we are striving to improve care and we should be working and focusing on well child care to improve outcomes. So in 2021, the Children's Health Leadership Team began designing strategies for a comprehensive approach to youth wellness. These include prevention, screening, and intervention for physical, mental, behavioral health, and social needs. And it involves working synergistically across all sectors, healthcare providers, school professionals, and community-based organizations. All sectors that work and touch children's lives. We really believe there is no wrong door to helping children achieve optimal health and wellness. We want to ensure that no matter what door that child knocks on for help, we will ensure a coordinated strategy to assist them in addressing their needs. Next slide, please. So if we want to focus on improving youth wellness, we begin by assessing the baseline of whether or not children seen by our primary care providers who submit data to us are obtaining well child care. That's where we have to start. In looking at the 2020 data we obtained from our clinical partners, we highlight a significant disparity in the well child primary care visits by race and ethnicity, with Black and Latinx showing a 14% drop and white non-Hispanic showing a slight increase of 6% from 2019 data. We know that COVID has had a disproportionate impact on communities of color and lower income, and this graph is reflective of this impact on children and their well care. Next slide, please. So within those visits seen on the previous slide by race and ethnicity, here we highlight the impact of COVID on communities with lower socioeconomic status. This graph shows the neighborhood relationship between area deprivation index and well child care rates, reflecting the higher number of children missing their well child care in 2020 that come from lower income neighborhoods. Next slide, please. So when we look deeper, we can see, for example, from this slide, the relationship between a child coming in for a sick or a well visit to their doctor and whether or not they received a lead test order. and whether or not they obtained a lead test if it was ordered. Children without a 2020 well child care visit were 67% more likely to be missing a lead order and 46% more likely to also be missing a lead test. Now imagine, this is just lead. Imagine if the same missed opportunities are happening for children struggling with obesity, asthma, and mental health needs. For example, maybe they never even have the opportunity to ask the question or answer the question, are they struggling with anxiety or depression or have suicidal thoughts? So we need to do a better job of getting children in for their well child care. And this just speaks to the kids that we know are coming in. We still have to find the children who aren't even coming in. So this is why we need to go very big in our approach for this mission. Next slide, please. So the secret sauce and the real value of Better House Collaborative lies with its members and their commitment to improving in the areas we identify as high need. They don't stop innovating until the problems are solved. They come together to share data, information, and learn from one another what is working well. They find the bright spots, and then they share that secret sauce with others so everyone can get better. In September of 2021, we had our annual report to the community webinar, and Dr. Matt Tian from the Metro Health System presented their secret sauce as an emerging best practice for improving lead testing rates in children. You can see from this graph that Metro Health created a system-wide quality goal to improve lead testing. They made it a priority, and they took testing from 48% to 86% just by drawing blood in the office and not sending those patients and children to the lab. It was an amazing, simple intervention. I call it simple. For them, it was not. There were a lot of workflow changes that needed to happen. And as you can imagine, with any change, overcoming the resistance to how we normally do business was also necessary. Another example of an influential leader in our community for sustainable change that's making a difference. Next, they will take their mobile vans into the community to find children who are not coming into the doctor for lab tests, and they will find a way to get them tested. For more information on all of this, please visit our website. That whole presentation was recorded, and you can find out more about just how to accomplish this work and perhaps replicate it in your own organizations. Next slide, please. Another great example of our members working together to find solutions is in the area of mental and behavioral health. This slide represents the multi-sector collaboration we are facilitating between Cleveland and Akron schools, primary care, behavioral health providers, academia, community resources, and the Ohio Suicide Prevention Task Force to address the rapidly rising rates of depression, anxiety, and suicide in our children. This subcommittee, led by Dr. Mary Gabriel of University Hospitals Rainbow Babies and Children, has been meeting monthly in 2021 to address the goals for ensuring that all children are screened for mental and behavioral health needs, to improve communications, data sharing between all of these sectors to enhance timely interventions and better care coordination for our children, and to build competencies in the school workforce, with community members, with parents, and primary care providers for identifying risk in children earlier and intervening sooner. Next slide, please. The Mental Health Subcommittee identified the need to establish more effective referrals between primary care and behavioral health providers in the community. And with seed funding from United Healthcare, we started a pilot project in March of 2021 to build a more efficient and effective referral system between Rainbow Babies and Children and the center's behavioral health care providers. Next slide, please. And early data shows a positive impact with two of the most important elements we're trying to improve here. One is the percentage of people and families that we connect with. And secondly, to be able to get information back to the referring primary care provider about what happened, whether that patient was connected and what interventions are being done. So in this pilot, we show that 67% of the families referred from Rainbow Babies and Children's to the centers were successfully connected with. And 100% of those had a successful feedback loop to the referring primary care provider. This all helps to enhance communication and to facilitate more timely care coordination between those providers. The connection rate is impressive, trending higher than other projects Better Health has worked on, connecting patients to community organizations and resources which only show 50% connection rate. Next slide, please. So in looking ahead, here's the roadmap for where we're going in the next few years with this multi-stakeholder comprehensive approach to youth wellness, and an overview of the implementation strategies we will use to achieve the goals for improving children's health as well as academic student success. Those strategies include awareness building and training. We need to increase awareness of the importance of well child care with parents, with educators, pre-K organizations, and all gatekeepers of children. Remember, no wrong door. We want to implement universal screenings for physical, mental health, and social needs to identify needs early in children. These can happen in primary care, behavioral health, even school settings, and we're talking about that right now. We need to build better data sharing infrastructure. This is huge. If we want to improve information sharing between primary care, behavioral health, schools, and the community, so that we can, in fact, improve well child care and outcomes. We want to enhance care coordination. That data will help us to do that, to ensure children who are referred to care and resources for interventions obtain that care in a timely and appropriate manner, and that feedback loop goes back to the referring source. We need to measure, monitor, and evaluate results. This informs our continuous improvement, it highlights our best practices for further dissemination, and it builds the case for future investments in effective interventions proven to work. Finally, we will replicate and scale what works. So thank you for your time. I'm going to now hand over to Chris Mundorf.
Thanks, Rita. So yeah, I appreciate Rita kind of framing it up with our work with babies and kids. I'll be talking a bit more about our work with adults that then kind of segged into our work within COVID-19. Similar to what Rita showed with kids in Northeast Ohio, there was a similar drop in primary care visits for adults during this past year and a half of the COVID-19 pandemic. Compared to the number of visits we saw among our member systems in 2019, we saw around a 5% decrease in people with a visit, which translates to around 12,000 fewer older adults with chronic disease coming for a healthcare visit. Next slide. Obviously, most of the adults we track through our member organizations have at least one risk factor that we know as a risk factor of higher morbidity and mortality of COVID-19. Things like diabetes, high BMI. Yet actually, as we kind of look at all the data together, we see that 1 in 5 of the adults we track, around 20%, have multiple risk factors. So more, obviously more than one of these risk factors associated with higher morbidity and mortality associated with COVID-19. Next slide. We also know that these risk factors are not uniform across the population. Zooming in just on Cuyahoga County for the moment, Hispanic, Latino, and African American Black adults are much more likely to carry these multiple risk factors for COVID-19 morbidity, mortality. And unlike white adults, the prevalence of risk factors remains high among these groups, regardless of whether the person lives in a high income or low income neighborhood. Next slide. So due to the equity issues surrounding COVID-19, we were so lucky that an opportunity came around to work with our region's amazing federally qualified health centers in coordinating their COVID-19 response. We knew from these data that I just showed you that there was a tremendous risk facing low income and minority populations in the greater Cleveland area. We also knew that there was a major issue initially in getting tests out to these communities. So last summer, with the leadership led by Kirsten Creation, we began working with our partners with Asia Inc., Care Alliance, the centers, Neighborhood Family Practice, Neon, and Signature Health to one, convene them all together and share best practices, how to effectively test large numbers of people in the community, and then collect and analyze their COVID-19 testing and eventually vaccine information to help drive data-informed decision-making around these health centers. This typically hasn't been what we do, but as Rita mentioned, I think it's all about really finding those opportunities to change and pivot and really kind of do the things we typically do, but in the new situation. In this setting, it's convening and using data to drive decision-making. So this would not have been possible without the support of each of these FQHCs, obviously, and as well as the Rapid Response Fund. I also want to make sure before I start presenting this, I want to acknowledge the amazing work of the region's health systems, Cleveland Clinic, University Hospitals, and Metro Health, as well as our local health department, Cleveland Department of Health and Cuyahoga County Board of Health. And as you'll see, this collaboration grew and grew as the months followed, as it included more and more stakeholders in the region. And at Better Health, we really just represent a small piece of this work, but we are darn well proud of the work we did here. So I'm really proud to share these upcoming slides. Next slide. So immediately when we began working, we started by pooling the testing data from each FQHC to get a sense of where people that were getting tests lived and where positive tests were coming from and where so-called testing deserts were popping up in the community. This helped the FQs to work together to strategically offer pop-up testing sites. This work then continued on into 2021 due to the leadership of folks at University Hospitals and Cleveland Clinic and the brilliant work at the GIS lab of Dr. Andrew Curtis at Case. Next slide. Then starting in January, when vaccines became available, we again pooled data from the FQs to understand where people were and were not getting vaccinated. We also received data from our partners at CCBH and CDPH, as well as Jamie Carmichael at Ohio Department of Health, really to help us understand where racial and income disparities were largest in the region. And it became quite evident immediately that we were not effectively reaching minority populations across Greater Cleveland. Next slide. So working as a collaborative, our first step was really taking the data that we collected out to the community. You know, again, not making the decisions in our little Zoom calls, but taking them out to the people who know these communities. So diving into the neighborhoods where either the vaccine numbers were lowest or the disparities were the greatest, we tried to understand why the vaccine wasn't reaching into different parts of the community. So for example, this was a map of the Central neighborhood, and working with our community partners in Central with the Promise neighborhood, they were actually able to help us determine which specific CMH housing facility would be the most important to target. Then this informed what type of outreaches our partners at Care Alliance then implemented in that neighborhood. Next slide. Next, Greater Cleveland Congregation approached us with a brilliant idea of offering vaccinations in churches, which they thought would allow for a more trusted venue for people to feel comfortable coming in and getting vaccinated. We piloted this on the west side with neighborhood family practice at a Latino Hispanic population, and an east side church with the centers with an African American population, both partnering with the Greater Cleveland Congregation and with the FQHC, with actually volunteers from all the FQs coming together. And we saw incredible results of reaching the community through this approach. This model expanded to include multiple houses of worship. We collaborated with Greater Cleveland Congregation, the Hispanic Roundtable, and other groups. So we used the data from our FQHCs to identify communities with low vaccination rates, and then identified nearby houses of worship that could be good venues to host events. Then we concocted a huge network of helpers through partnerships with our local health departments, Ohio Department of Health, the Ohio National Guard. Vaccines were brought in through the event, run by the FQs, administered by the Guard, hosted by the church staff, all kind of working in tandem. It was a beautiful, beautiful, beautiful setup. Next slide. And this strategy proved to be a really great success. FQHCs began adopting this strategy at more and more events, really pushing themselves to try and find new and innovative approaches to get that vaccine out of the clinic and partnering with relevant community groups. So while in the first few months of vaccine availability, FQHCs, like everyone, really struggled to reach minority populations. Yet, as a result of this strategy, in part due to this strategy, not entirely, and most importantly, due to the amazing efforts and outreaches conducted by each individual FQHC, they were doubling or even tripling their reach into the various communities in just a few months, far outpacing other providers in the county. Next slide. Another endeavor that allowed us to reach out to this population was our launching of the Pathways Hub, as described earlier. It's launched just right when the pandemic was starting, which was either good or bad timing, depending on how you look at it. Again, for those not aware, the hub is a care coordination model that works with community health workers, CHWs, and community agencies that connect them to reimbursement from managed care organizations for their work in addressing people's social determinant of health needs. Next slide. Several hundred adults and kids have already been enrolled into the hub in just these past few months. And a vast majority of these people have severe underlying needs, whether a need for a job or a home or exhibiting underlying mental health or chronic health needs. I think really the takeaway is it's multiple risk factors all interacting with each other that allows, it's important for that CHW to work with that person and work with all of their different needs. Next slide. Based on those needs identified by the CHW, the CHW will then work what's called a pathway. So using evidence-based approaches to help resolve the client's needs. Over 2,000 of these pathways were worked by CHWs in the county these past few months. By far, the most common job of CHW is really just talking and providing education to the person, whether on safe sleep, healthy eating, or as we'll see, ways to protect yourself from COVID-19. The CHW helps the person get connected to whatever services they might need. And when certain milestones are met, these pathways are successfully closed, meaning that the need has been met and then the payment from managed care organizations can be connected to the agency. And I think it shows really the hard work of the CHWs that over 4 in every 5 of pathways open in during this pandemic have had a positive outcome. Next slide. In addition to educating, the CHW's really core job is just providing that wayfinding and support to the person in need as they connect to relevant services across the county. These can range from connecting them to food pantries, our Greater Cleveland Food Bank, organizations working on utility assistance, or getting them housing. And the data from the hub can really help us identify where connections to those agencies are strong, where there's a really clear tunnel getting them, and where there may be an issue. For example, you'll notice on this chart at the very bottom, we have a very low success rate of getting people connected to clothing assistance. And Ginny from Carmela Rose actually brought it up on a previous webinar we held, where a major aspect driving why those weren't working were due to COVID-related restrictions that were being placed on these agencies during the pandemic. So again, really keeping people from meeting the needs due to sort of these extraneous situations. Next slide. So due to the work with the FQHCs, it was becoming apparent that many testing positive were identifying, again, multiple social needs, and it sometimes led to an inability of them to be able to safely isolate. So we were always on the lookout of finding ways to potentially leverage our CHWs and help support people navigating their COVID diagnosis. So we were very lucky to be approached by United Healthcare. They had piloted a model in other cities across the country, kind of a mass testing approach, and they really wanted to bring it to Cleveland. So they used analysis from our FQHC data, and they at UHC identified several neighborhoods on the east side of Cleveland, and they brought together churches from Greater Cleveland Congregation, nearby FQHCs, all in an effort to help supply tests, food, and other aspects to a trusted venue for people to access. And just a few short weeks over the Christmas holiday, right when we were experiencing a record surge, over 3,500 people were tested in Eastside Cleveland and given food and other supplies. And very proud of the numbers that UHC achieved, with over 2/3 of those getting tested were African American. This was so great, and we were also able to happy to be able to connect CHWs into this workflow. In those testing sites, if people had additional needs or expressed concern about isolating, we were able to link them on site to a CHW and brought them into the hub. And so through this event and then over the subsequent months and year, CHWs have offered COVID-19 support to over 100 people in the hub, providing education or connecting them to testing or vaccination. So this work is ongoing, but I think it's such a great example of really the value of collaboration of what we're really all about here at Better Health. Next slide. So this is our certificate of participation from the governor, which we're really proud of. But again, really it represents the all of the work of these organizations. For many of these organizations, this was our first time working with them. We had to meet via Zoom, which is always very hard. And I really learned good lessons from folks at Greater Cleveland Congregation that these collaboratives have to be built on trust and relations, and they cannot be transactional. And this is obviously very hard to build trust on Zoom, but you really need to establish that trust before anything else can happen. So we truly are so lucky to have so many fine federally qualified health centers in the region, and through the hard work for groups like Greater Cleveland Congregation, the Hispanic Roundtable, governmental groups like Ohio Department of Health, CCBH, CDPH, the hospital systems, CASE, and gosh, even the National Guard, and of course the support of collaboration of funders through the Rapid Response Fund, we were able to make a sizable impact on our community. And we've gotten recognition, the certificate, a New York Times article, the governor highlighted our collaborative in one of his cool afternoon briefings, but all of this really is reflective of the work of the broader collaborative. So we're just thankful to be able to play a small part in it. And obviously the work is ongoing. Unfortunately, we'd like for it to be over, but we are happy to continue this work as a part of this group. So thank you very much.
Thank you so much, Chris and Rita. Boy, this demonstrates so much of what we've been talking about, the importance of the hub model as a sustainable piece of addressing the social needs and medical needs of our communities. The demonstration of the power of partnership in our COVID efforts, all things that we've been talking